In lung cancer, there are new targets being identified, again, smaller and smaller niche areas, which will basically require next generation testing for most non-small cell lung cancer patients. So once we've identified the targets, then there's a drug developed accordingly. So I think a lot of these are in their early phases. The most recent one, I guess, has been the NTRK. So this is a particular fusion protein which has been identified, and there's a drug against this also. But again, I think the challenge will be trying to get testing organized for these patients. These are really rare mutations, and it would be sad to really miss these patients. However, if you don't test, you're not going to find, and you'll have to test 60, 70 patients before you get one positive. So it's a small return, but we've got to think big. They've got to do it at the diagnostic level. So when you have your first biopsy, the best way to do all the testing is do it all at once. And that reduces the amount of tissue or DNA that you require. And the technology is now getting cheaper and cheaper, so more affordable. So I think that's the way forward. It's going to be next generation testing, sequencing for lung cancer testing. And I think that will be done at the time of diagnosis. There'll still be patients that you could retest, or if they're already in that system, for instance. But I think the paradigm certainly would be next generation sequencing at the point of diagnosis.